right, welcome to the Right Tack, where we help private practice owners face the headwinds of the healthcare industry. I'm Paul Jonas, CEO. Are those the headwinds we're dealing with today?
Yes.
Okay.
Those were the
CEO and co-founder of BreezyBilling and Phoenix Credentialing.
And I'm Jim Jonas, therapist, co-founder of BreezyBilling, Phoenix Credentialing, and the Jonas Center.
So today we are going to talk a little bit about credentialing and contracting, and I'm going to get on my soapbox. Yeah.
Our favorite topic.
Well, definitely one of mine. And as a therapist, I can only imagine you've tried to avoid it like the plague.
Like the plague.
And when dealing with it, you totally just kind of half arsed it.
Yeah. Yes. Talk about meditative breathing. You better know how to do it.
And if you know how to do it, it does kind of make sense. That's the thing.
Oh,
it doesn't make any sense.
Meditative breathing or credentialing and contracting?
Been in the yes. Well, no, I don't know anything about meditative breathing. I can't say that I meditate.
Oh, geez.
But I do deep breathing, little box breathing when I'm stressed or anxious.
Yeah.
I do a little box breathing.
Somebody was talking about that the other day.
It's good stuff.
Well,
yeah. So we'll be digging into credentialing and contracting.
let's dive in.
All right.
I have some questions.
Well, before we do,
yes,
we've been on kind of a binge of recording these episodes now, but thankfully the topics are timeless. Because we're gonna get this out. I don't even know when we're gonna be releasing this, but we always ask
soon.
We always ask what we're doing this weekend or what you're doing this weekend. And lately, you and I are seeing a lot of each other.
We sure have. Oh my gosh.
So, Dad, what are we doing this weekend?
This weekend? Wait, this is the weekend. Your sister's getting married.
This is the wedding
weekend. My daughter. Yes.
Yeah.
Okay.
Yep.
And people are starting to come in on Thursday.
Ooh.
Yeah. And then Friday. And then Saturday, she's getting married, thank goodness, at her place.
Yep.
Should be nice.
Should be nice.
Yeah. Yeah.
I'm really excited.
This past weekend, we've been hauling things to and fro, and I got to use my new side-by-side a little bit to haul the grill over there. That was really great.
You know, you have so many cool new things. You have the solar panels. Now it's the side-by-side. Yeah. Heard you took it into town the other day.
Yeah, I got gas with it. Oh, my gosh. You know what? I think there's a governor on it at 45.
Oh, yeah?
Yeah, it will not go over 45. I tried to top it out.
If that's a legal limit, then we should probably follow that. Otherwise, we should figure out how to...
ungovern it?
Yeah.
Yeah.
Maybe not.
Great.
Maybe not. We don't condone that for anyone.
Oh no.
So I don't know. We're doing the same. We're doing the same thing. Very excited to see her getting married here this weekend, and you know, her fiance is phenomenal.
Yes,
and it's gonna be a good old time.
It should be great. Yeah,
good celebration. Lots to celebrate.
So that'll keep us busy and out of trouble. Hopefully,
we'll see about that. All right. So so the topic today.
Oh, the topic.
And maybe we get back. Like I'm realizing, like I've got you. You've been doing this for a few decades.
Yeah.
And so like the experience of credentialing or getting your first contracts, or I know you did your own Medicare. I'm going to say back in the day. I don't know if it was still horse and buggy or if it was gasoline engine.
Dinosaurs. Oh my gosh. That was, years and years and years ago. I don't even know you know what? It's been so many years. When did I get, I should tell everyone here, I'm old enough that I actually got grandfathered in. Did I say this on licensure?
Yeah.
I got grandfathered in as an LMFT and an LICSW back in, I think it was 89. So that goes way back to then. And the credentialing and contracting, I don't remember signing the first one. We're talking 1980, 81, probably 86.
Okay.
Yeah.
Okay.
So, and to be credentialed, I think you just had to be an LICSW and they let you do it.
And then, then you've just every year a new copy of the license and
yes,
upload your updated insurance information.
Yeah.
And into I suppose here in Minnesota Credentialing Collaborative and CAQH is where you manage your credentials.
Yeah. And that works really, really well. And one of them charges, it's worth every penny.
Oh my gosh, yeah.
Yeah, to keep you up to date.
Just to not have to delay if the insurance company loses that thing you faxed in, because fax is still a thing here in healthcare, going strong.
You know, I did have this question, though, for you, Paul.
Yeah.
It's like, who can get credentialed? and well, let's start with that. What do you have to, what qualifications do you need to get credentialed?
Well, you need to be licensed. And so and then, behavioral health, that's your LSCSW, LMFT,
So it's,
LP, or LPCC.
okay, it's
Or
independent licensure.
it's independent license. Well, and I guess it's not necessarily that, but and I can speak on the behavioral health side of things. It's the recognition of the when you get your credentials, and so that's those letters behind your name. And I think this goes for just about any part of the industry, but like those are your credentials. And credentialing is the process of the insurance companies that you want to work with recognizing those credentials. And so you have to send them information that proves you are who you say you are, that your license is what you say it is, and that everything's valid, and you don't have any big knocks against your history. And if that all lines up, when you apply and then it gets approved, then you're approved to see their subscribers.
Well, then, but what about the contract?
And this is where things love to get messy, a little bit. And
that wasn't a script question.
No,
we're just going.
We don't even have a script today. So we got our scripted intro and outro just so we kind of know what we're talking about and keep it consistent. But this is definitely a little more of a topical, I don't know, a topical
unscripted,
run.
Yeah,
unscripted. The Jonas guys, unscripted.
What? Well, improv in dance. They call
okay,
it.
Off the cuff.
Comedy. Yeah, okay.
Well, so this is one of the soapboxes I get on is in the industry we tend to just call it all credentialing, but in reality, credentialing and contracting are completely different paths. Now they parallel each other because they happen often at the same time when you're starting a new practice. If you don't have your credentials already, but it's really kind of the generic term for I need to send a big long application into the insurance company and I don't know what to put in all these different places.
Okay.
And I hope they get it and it comes back and I get what I need. So really the way to think about it is credentials belong to the individual. So you have your license, you have those letters behind your name, those are your credentials. And so credentialing sticks with you. And so for anybody out there, if you don't have your CAQH account, or like I said, in Minnesota, we've got the Minnesota Credentialing Collaborative, or MCC. Other states have their own programs, and a lot of them just also use CAQH. And I should have looked this up because I have no idea what CAQH stands for.
That's a good
question. But a lot of payers use that to manage that. And it's really just managing the details about yourself and your work. So credentialing sticks with the person. That's with the individual. And so an individual gets credentialed with an insurance company, and that's just Blue Cross, Anthem, whoever saying, hey, I recognize your credentials as being valid and you could see our subscribers. Contracting is the business agreement between the insurance company and your business. Now, whether that business is a group, organization, or if you are a business entity like a sole proprietor, which we do not recommend, then contracting is the process of applying for a contract with the payer, and if they approve, getting that contract and signing it. It outlines all the terms and your timely filing, how to find your fee schedules, what you should be getting paid, and what happens when things go right or wrong or anything like that. So that's the contracting part. So that's the biggest confusion I run into with those two things.
Okay, can I ask you this though too?
Yeah,
because I know this comes up. Like, are there some insurances, if they believe that they have enough therapists within a certain area, they can refuse to contract with you? Is that correct?
They can again, yeah. At least in the state of Minnesota, that was not the case until this summer.
Okay.
So there was a law passed that did not get renewed. I'll have to put that in the liner notes or something with your liner notes. What am I talking about? CDs and albums? The notes on the podcast. Yeah, so there's a law in Minnesota that basically required payers not to take into account geographic region and how many providers are in there, because a lot of providers were tired of getting denied when it was very obvious that there was not enough support, and that those insurance companies, that their subscribers needed behavioral health professionals in the area. So that sunsetted this summer, and as of the summer now, we're even seeing applications getting denied again
Wow.
from
Okay.
some payers. Not definitely not all, but from a handful.
Hmm. Okay. All right. So you're saying credentials, they stay with you. Contracts are a business agreement between you and the insurance company.
Mm-hmm.
Okay. Um, what else? Go ahead.
Well, down the line from there, the some of the hardest messes to unravel are ones where someone attempts to do this process without either taking their time and making all of the phone calls for every roadblock you hit along the way, or who just fill it out willy-nilly and send it in, or who don't understand the business side of running a private practice.
Okay.
And then with those contracts, then when they're not keeping them up. And what I mean by that is, if you change office suites, you need to let those payers know. If you add providers, you need to let those payers know. And when things don't jive, and it's especially becoming more important now how you set yourself up on your contracts initially, because as our industry comes under more scrutiny, um, and and just as as how claims, the claims you submit get processed, under a bigger magnifying glass. It's becoming more important that you have everything lined up and all your ducks in a row on those contracts. Because if there's something that doesn't match, that's grounds for denial. And then it's a weeks, if not months long process.
Oh,
First you have to figure out what the denial's for. Then you have to, figure out what your contract looks like. Then you have to update it so that it matches your current state. And then you have to go make sure all your other contracts are up to date too.
so this could take a long time to
It
get you
takes a while.
paid. Yeah.
Yeah, it's like, well, when you have a wedding, everything costs $1,000. When you deal with insurance companies, everything takes at least a month. Like, you measure everything in 30-day increments.
Hmm.
It's a
Okay.
months long process. Now some of those contract updates you can get done in weeks, just kind of depends on the payer. But generally we tell people it's going to take at least a month to do anything.
Okay. Okay. Well, then the other complication I was thinking about with this is okay, so you've got an independently licensed person who's now a supervisor,
Hmm.
and they supervise someone who's not yet independently licensed. How does that work with the payers?
So that is you putting your credentials on the line.
Okay.
So if that individual makes a really bad mistake and you don't do anything about it or don't act appropriately, then it's your credentials that the board comes and looks at. What that means from an insurance and credentialing contracting standpoint is some insurance companies don't allow supervision.
Okay.
And again, in that would be Optum primarily, unless you got grandfathered in under their supervisory protocol, and then Medicare. And Medicare is a real interesting one, because you can call Medicare 10 times and they'll tell you supervision is covered, but the people you're talking to, in their minds, they're thinking of what's called incident to supervision, not necessarily clinical supervision.
Okay.
And that's a gotcha. We just did a blog post on that for
The
BreezyBilling.
the incident too.
Yeah, and so incident two is like, you go in and see your doctor, you come up with a treatment plan, and then like the nurse practitioner, the PA, is the one who actually carries that plan out. So they are doing work with you when you come back in the next day. You might not see the doctor, but you're working with the PA.
Okay.
So if you go in and see that person, you are running the treatment plan that the doctor approved, and it is under the doctor's supervision that the PA is working with you. But you're not necessarily talking to the doctor. It's just under that doctor's supervision. That is incident two.
Okay. And a supervisee could do incident two.
In behavioral health,
Yeah.
like, the situations are so rare, it's basically no,
Okay. So that's good to remember.
because it's not your typical clinical supervision.
Okay.
So
Okay.
if you're doing that, then it doesn't count. So
Yeah.
that means supervisees cannot see direct Medicare recipients. and they cannot see anyone on Medicare Advantage either. On those Advantage plans, like Blue
Oh,
Advantage,
yeah.
those count too. You cannot have supervisees seeing clients on those plans.
Huh. Yeah. Just seems kind of ridiculous in a way. How do people learn how to do therapy and that kind of thing?
Yeah, health partners used to be that way, and then they got rid of it. So they started to allow supervision
Okay.
again. So
Okay.
that was a move in the direction of allowing, allowing future behavioral health providers to learn on the job, which
Okay.
you have to have in healthcare. I mean, there's really no way to do it, whether it's medicine or behavioral health.
Well, the other thing then too is that when you send in, if you're supervising a supervisee
Hmm.
and you send in a billing for that,
Hmm.
there's a modifier that you need to submit with that,
Yep.
indicating that this is a supervisee, correct?
Yeah. Yeah.
Okay.
And for most payers, it's either going to be an HN or HO. So HN means you have at least a bachelor's degree. So that'd be somebody who's working towards their master's.
Okay.
HO means they have their master's degree, and that usually means they're working towards their licensure.
Okay.
And then there's also there's a line item. So in the CMS 1500
Oh,
that
yeah.
we talked about a little bit last time,
Yeah.
there's a line item for that. So you put a DQ, you put a DQ qualifier on there with your, with you as supervisor, and then your credentials. So on the claim, it's got the supervisor's name on it, but on the line with the DQ, and then with the there's an HN or HO modifier typically. Now Optum is different. Optum kind of they get to be different. They're one of the biggest conglomerate, one of the biggest insurance organizations on the face of the planet. So they have some different rules around that, and that's again only if you are grandfathered in and already had a supervisory protocol on file with Optum as of I think it was last fall or last summer, and they already weren't giving them out. And they probably start taking them away as you recontract. So we'll see which direction that goes. But they require a U5 modifier. It's a little bit more like a medical claim with Optum.
Okay. Who keeps all this stuff straight?
No one.
Okay.
It's a lot. Optum did a real good job of announcing this. I'll say
Okay.
they made it very clear how to bill and what to bill and when you could bill. So on the billing side, it's that. Other times it's trial and error, and you send some claims on a wing and a prayer, and see what comes up, because oftentimes you're going to call in and ask questions, and it's that any question that's not, what are the benefits or was this claim paid out? It goes beyond the pay grade of that first line of
Oh boy.
of call center.
Okay. This is after you wait that for 45 minutes and you
Yeah,
take
15 to 45. We'll give them a little credit.
breathing.
Yep.
Oh,
And
15.
sometimes you
Okay.
get really good people that are insanely helpful, and
Yeah.
that's a blessing when that
Yeah,
happens. But
that's true.
it's not all the time.
Is there a good day of the week or, morning or afternoon to call? Have you guys figured that out?
Yeah, just guess. No, don't call around lunch. I know some payers actually don't answer the phones around lunchtime. They just shut down the call center. Otherwise, I guess we just call all the time.
All the time?
There's some, I mean, some say like a Tuesday or a Thursday has been recommended to me, just because all the weekend stuff hits on Monday, and then Friday people are off, and at the end of the day, no one, people are finishing up phone calls, so you don't want to call the last half hour before, because you're probably not going to get through.
All right. Well, I have one other issue.
Yeah. This is like the Ask the Biller is what we're really doing
This
here.
is great. Okay. Somebody here take notes.
One other professional issue. I mean, we got.
Okay. Well, I could do the clinical, you do the billing. We're good. Yeah. Okay. How is it being the son of two therapists? Oh, we won't go there.
That's going to take a whole nother episode.
Okay. Yeah. No, what I've been noticing in my, in my aging through this whole system is how much more documentation you need to do throughout the year. Okay. So if you could speak somewhat to that, it's like quarterly I need to do something, and then annually updating my credentials.
Yeah. So that's really, those are your attestations. And honestly, it's a good idea to do it on a regular basis.
Oh, it is.
But it's also a good idea to check your emails. I
Yeah,
really am. Like some providers choose not to check their emails, and then we will get an
that's fair.
email that it's third notice, and you have until 2 days from now before it's all
Yeah.
to reinstate your credentialing or to
Boy, and you don't want to let that lapse, do you?
no, and
Because
especially now you don't want to let it lapse, and especially if you're dealing with payers that have closed to new contracts, because you are the only if there's no other clinical providers on the contract, they will terminate that contract.
whoa.
Often. And again, each payer has its own policy for how it does that. It's in the contract if you read that fine print.
Oh yeah.
But right. um, so it's yeah, so it's in the contract, but so you want to just always keep up on those online accounts like CAQH and MCC. Those are just worth it because it makes it simple. You once you get it set, you basically update two things and then you can just resubmit.
Right.
Unfortunately, the customer support isn't that good if you're lost. So we often actually find ourselves at Phoenix Credentialing. We often find ourselves helping people out because we can get in there, whip it into shape, and
Oh.
then submit it in 15, 30 minutes.
Part of this for me though, too, it is looking for those emails and then, going on and attesting and it keeps taking up more and more time.
Yeah,
Okay, administrative time. And it's like,
yeah.
whoa.
I mean,
So,
behavioral health wanted to get into the healthcare industry and be
yeah.
considered, true healthcare, part of healthcare, and it's compliance.
Okay.
So there's just a lot of compliance in healthcare, a lot of
Yeah.
administration. And that's what we're doing here right now with this is we're just trying to help any provider deal with that or expect it and know that, you should be checking it out every 90 days. Just
Hmm.
put an
Hmm.
hour on the calendar, review it and let it go or hire a company to take care of it for you.
Yeah. And I do have a couple of incidents where one or two of the therapists, didn't see the email
Mhm.
and it was hell on wheels to get back in. And thank goodness they got back in, but it took a while. And
Yeah.
and the insurance company will stop payments,
Oh yeah, because
obviously.
you're not credentialed anymore.
Yeah, you're not
But you have to
credentialed.
resubmit an initial.
Well, you've really got to be watching for that.
And it can take credentialing, getting re-credentialed after that'll take a few weeks, and sometimes they'll backdate it. Uh,
Okay.
it depends. The other thing that I really want to talk to anyone who's thinking about starting a practice with your contracting is what you need to do to prep for that.
Hmm.
And because everyone's got to remember, starting a private practice isn't just going out and helping people. It'd be great if it could be, but it's a business, and you're in the business world. And so the other big thing, and we've covered this in some of our previous episodes, is just getting your business details organized before you apply for any contracts. Um, and you want everything again. And I know I've preached this in previous episodes, and we've had people on talking about it. But you need to make sure the business entity stuff is set up right. So, you've got your LLC most likely set up. You don't want to be a sole proprietor. You have your business tax designation. So, we recommend S Corp. You don't have to be. It's just easier. These are huge insurance companies that are used to dealing with other companies, and they're used to dealing with corporations, which
Yeah.
is it just greases the skids a little bit. Like I said, you don't have to, but it means a few less questions, makes it a little faster to get through that contracting phase.
So years ago, when the Jonas Center became an S corp, um, the legal name was the Jonas Center.
Oh yeah.
I'd suggest maybe skipping the in your name because there's a lot of thes out there, with that's the first word. So, if I had it to do over again, it would be Jonas Center Inc.
Okay.
So, yeah.
And is that just why? Without
Well,
the it's just like in a lineup, you're in the T's.
you're in the T's,
Okay.
a lot of T's, and you always have to explain it's the Jonas Center, not
Okay.
Jonas Center. So
Yeah, well, and enrollment. So when you talk about Medicare and Medicaid, it's called enrolling versus contracting. You enroll with
okay.
those, and with Medicare especially, like if you have a comma misplaced, they'll deny your application.
Okay.
So
Okay.
that's how important this stuff is, and that's why we preach to everybody. Whatever your business name is, with however many commas or periods or whatever, that's what it needs to be on your checks. So on your bank account, it needs to be right. And that's what it needs to be on any application that you submit. So any of your business stuff, your business name matters down to the punctuation. So just make sure and get all that lined up because that makes the contracting process easy. And when the contracting process is done, then that makes the billing easy. So you're dealing with less denials, less weird stuff. And we've seen everything between the two companies, but the billing and the credentialing company uh, that it'll deny for one reason, but it turns out it's a whole different reason that sometimes is one of those more technical things.
Yeah. Boy, and I can really attest to what you're saying there too. It's got to be all lined up
Yeah.
for sure. So,
Well, so we ended up doing some of your enrollment work for Medicare
yes.
because, I mean, that is a government entity,
Yes.
CMS.
Yes.
And you've done it initially, right? But then
I did it initially for the agency
Okay.
and for myself, I think, because only back a few years ago and before, only LICSWs could see Medicare people. Then they opened it up to marriage and family and LPCCs. When was that? A year and a half ago, I think.
Yeah, the beginning of 24.
Yeah, okay.
January 1st, 2024.
Okay. And that's when the Jonas Center hired Phoenix Credentialing to do that enrolling of our LMFTs and LPCCs. And that went rather smoothly because our person at Phoenix, once she got the pattern down, it was just so much easier than me trying to go in and where's this form and where's that form and back and forth all over the place. It does give you a headache if you don't know what you're doing.
Yeah, because calling through, I mean, there are great people and there are people who are still learning.
Yeah,
I'll say.
Yeah.
And same thing too. I mean, a lot of people really don't like Medicaid, but the one thing about the government entities is they are rule based. And so
that's true.
Unless you get somebody again who's learning, then you just have to follow the rules. But finding that rule book or building that rule book on your own is very difficult. And that's why, sometimes it's worth it just to pay somebody to take you through that labyrinth.
Yes, labyrinth. Good description.
It is, yeah.
Let me ask you this: there's a Medicare number, a Medicaid number, and they're different, correct? One of them's with the state. One of them, I think, is my group NPI. It's a little confusing, is what I'm saying.
Yeah. Okay. Yeah. We could so Medicare, you get a PTAN, provider transaction AN. I can't quite remember, but you get a PTAN, and both it's kind of like an NPI, but it's just for Medicare. And so the PTAN, there's an individual PTAN that every individual who's enrolled with Medicare gets, and then there's a group PTAN. Because the NPIs weren't good enough. I don't know
the NPIs weren't good enough, even though they're as good as what they identify you.
Yeah, and then Medicaid 9 times out of 10. Well, if you're a licensed provider, your Medicaid ID number is your NPI. If you're in a program that doesn't require licensing, you might get an UMPI in Minnesota.
Oh, the old UMPI.
Yeah, that's the Universal Minnesota. I don't know if you use Universal, man. Minnesota Provider Identifier, and so you can get those. So there are some
odd uncle that you have in your family.
Your UMPI.
Just checking.
No.
Okay.
Now that we're having another uncle marry into the family here for my kids, we might have to start calling him UMPI.
UMPI. Okay. Oh shoot.
Oh man. Okay. It's
so UMPI is something universal.
It's a Minnesota Provider Identifier.
All these different numbers. And yeah, why do we have an NPI and a group NPI?
And I'd say, if you're not a spreadsheet person, then Then take a piece of paper and put it in a very safe place and write all these numbers down.
That's to all you therapists here. Grab a piece of paper.
And then also have a business folder for all the paperwork that you get too.
Wow.
Because if you so like when Phoenix does any kind of credentialing or contracting work, we require your it's called a CP 575 that the IRS gives you when you have your official designation. That's the letter that says, "Hey, we recognize you as this name, and this is your new federal tax ID."
Okay.
So hold on to that because we keep
hold
that
on
for
to that.
proof,
Yeah.
and that between that and what you have registered at the Secretary of State for Minnesota, which is usually where you go to register your LLC first, and then you go get your IRS and you go apply at the IRS for a tax ID. Um, Between those two things, those are kind of the Bible of your business details. What's
Okay.
listed there. So that tells, what kind of tax does, what your address is, what the business owner or officer's name is, and then what your company name is. And so again, that all needs to line up. That all needs to be in sync. Then go back to the bank account. That needs to be in sync on there with the address and the name. And then that all needs to be in sync with all the contracts that you put, that you're applying with.
Easy peasy.
Yeah. When you say it like that,
Right.
tracking it and not forgetting that comma when you're filling out the application, that's the hard part.
You do it once and you learn pretty quickly. I will say that.
Yeah. Well, and then there's questions in all the applications about, what, are you designated as rural? What's the difference between a rural mental health center and, community mental health center or things like that? Are you one of those? Or, what provider type are you on the Medicaid application? Well, in Minnesota, behavioral health providers are number 34. I can't remember exactly which one that is because I haven't looked at an app in a while. But it's
that number
34.
rings a bell.
Yeah, so if you're not a 34, you're in an entirely different provider type, and that can affect your billing. That can affect your billing too. So that can determine. I know we had one customer once that was not the 34; they were something else, and so their billing was they'd get paid more per hour, but they also had to do all authorizations because they were considered a different program. So they're still doing behavioral health. They're using H codes instead of your CPT codes like your 90837s and stuff. And so it's a more administrative burden for a little bit more money that way. So there's those considerations. So we recommend 34 just for standard outpatient behavioral health when we're doing that.
That works pretty well for us. Okay.
The only other thing that I can think of is if you are having billing issues, double check your contracts. We've had people come to us where that's another big thing. Don't use your social security number. Just please don't. That is no longer okay to use for your business. Your business, you need a real tax ID.
Sidelight. When I was in college, that was a few years ago, my college ID had my social security number on it. And that's what you use for everything, including, identifying yourself for meals. That's how far back I go.
And I have the same problem with paper checks.
Oh,
I hate paper checks.
God, me too.
Because they have your routing number, which is public anyways, but then they have your bank account.
Your bank account.
So if anyone gets a hold of one of those, they've got your bank account. You ever think about that? I hate writing paper checks. But yeah, the social security number used to be just
the ID. It was
just a number that kind of identified you, but that started to become so much more important and used to identify you for much more important things. And now it's turned into this like don't share, don't share with the world if you can at all help it. And of course now, I don't know, probably half the people's social security numbers are public information somewhere. So freeze your credit reports, everybody. We can get right into that. Goodness knows I had to do that. Somebody had my social and filed an unemployment claim against our own company here, Breezy. Remember that? It was like 3 years ago.
Oh my God.
3 or 4 years ago.
Yes.
Yeah.
Oh my God.
I was filing for unemployment against my own company here, our own company. So it was time to get everything frozen and locked down. So just to, don't use your social security number for anything business related at all whatsoever. Go get yourself a tax ID.
All right. And you also have said this before too about a home address, right?
Yeah. And you can use that for a business address. Just know it is technically public knowledge. So the Minnesota Secretary of State, where, us being based in Minnesota, we do a lot of work here. And so whatever you put on that application when you filed for your LLC, that is publicly available just in the Secretary of State site. Now, your NPI, when you go file for your NPI, that not only is publicly available on the NPI site, but it is also then sucked up by all these data aggregators that are also trying to get your eyeballs and advertisements with it by doing NPI searches. And so your NPI and all of your information that you put when you register for that, whether it's a single or your NPI one, your individual or your group NPI, that all is not only public on the registry, but is then sucked into all of those other NPI sites too. So once it's out there, it's pretty hard to get that back.
Okay. Huh.
So addresses matter too. So this is the numbers talk.
Yeah.
Whenever I'm meeting with a new, somebody who's thinking about starting a practice or a new provider, I call this the numbers talk because it's all about your tax IDs, your bank accounts, your address, and your NPIs. Those are all the numbers you got to really care about and keep in order.
Okay. That's good. Huh.
And then, I feel like we're kind of wrapping up here a little bit.
Are we?
So I think one last thing is when you are adding service locations or closing them down, like that demographic information, all the insurers need to know what that is. So if you have a service facility, then that needs to be on your contracts. It's just because contractually you're letting them know where you're offering services. But B, also for their search tools too, the things that people use to go find new providers, is it keeps those up to date too. So you want to make sure your hours are accurate. You want to make sure your locations are accurate. Which providers are at those locations. Which ADA, the disability access you have and how you approach that, closest to bus lines. That's one of the questions that a lot of payers ask is how close are you to public transportation? So again, keeping those contracts up to date, or really you're just keeping the payers up to date with what you're up to. And then you get more, in addition to the pain of having to fill out those provider updates, you at least get more exposure then with accurate details. So really, it does matter.
Well, it does. But as a therapist and as an administrator, and kind of an old guy, different websites. Some websites are really easy to navigate and to, okay, add, subtract, do this, do that, and it's very simple. Others are just really difficult. And so you tend to want to go, I just don't want to deal with this, with the harder ones. And I wish all the web developers would do it the easy, simple way for therapists and, administrators.
Well, everyone's got their own set of lawyers with their own set of requirements.
Okay.
Wouldn't that be nice?
Yeah.
Here in Minnesota, we do have the Minnesota Universal Provider Update Form, I think it's called.
Oh, yeah.
And so that does, for the majority of the major payers in Minnesota, you can use that and then submit kind of the same thing to most of the big payers in the state. Others require you to go through their enrollments process or their provider update process on the website as well. Some definitely do it better than others.
Yes, I agree. For sure.
Anything else you got?
I think I've complained enough.
Yeah, and I've been on my soapbox.
Okay.
Numbers right.
Yeah.
All right. Well, I guess that's it for this episode then.
Well, it is.
So make sure to follow us wherever you get your podcasts.
Yes, and share it with your friends and colleagues if you like what you hear.
So until next time, I'm Paul Jonas.
And I'm Jim Jonas.
Keep your eyes on the horizon.